When we talk about a bone graft, we have to understand that the base of an implant is always the bone. When you have a tree, you have to have a very good soil, okay? A bone graft is a bone substitute. We have several clinical situations as first, when you lost a tooth, most of the time, the anatomy of the roots, once we do an extraction, we have several roots, several void spaces. When we place the implant, an implant is like a screw. It has like one root. So there are gonna be some void spaces around that implant that have to be filled. The elderly patient, old patients that have been living without teeth for a while, because of lack of stimuli in the bone start to shrink. When we have a periimplantitis, that is an infection around an implant, of course the reaction is to lost bone because the bone goes back reacting to the bacteria. When we have a root canal and that root canal is extracted, of course the bone shrinks as well. So in several situations, sometimes we need a bone substitute or we need to increase the actual bone of the patient. When we talk about bone graft, we have several options, right? We have synthetic bone graft, that is a bone graft created in the lab that contains several structures that are very similar as a bone, but it never affects the healing process. We have an animal source, and the name is a xenograft. Nobody wants a little piece of a pig or a little piece of a cow inside the jaw. The allograft is a graft from the same species, from a human, but of course from a dead body. So it's a piece of cadaver, they processes the bone, but in general, the main problem is that depends on the lab and of the brand, you don't really know the whole process. So at the end, it's very difficult to detect if they have like viruses, pieces of proteins like prions, etc., etc. So at the end, nobody wants a little piece of a cadaver inside your body. We also have a human autograft. That means that we can take a little piece of bone from the patient from another area, we can harvest it and graft as a bone graft. Nobody wants a secondary procedure and another area of harvesting for a graft. If you ask me, the best or the perfect material for me is the one that contains hydroxyapatite and calcium sulfate. That's made in the lab, of course, but one of the main advantages is that you're never gonna have some kind of piece of animal, cadaveric, or any foreign body in your body. We talk about hydroxyapatite. Again, it's one of the main components, the mineral components of the body. That hydroxyapatite is kind of a ceramic. We're thinking in ceramic when we talk about implants, but this hydroxyapatite is a kind of a ceramic. So it's very compatible at the end with the ceramic implants. So we're talking about ceramic plus ceramic. There is another factor. The hydroxyapatite is a non-resorbable material. So in general, at long term, it allows to hold the soft tissue. It never gets completely dissolved. So at the end, it's very good when we try to increase the height or the volume in some areas. When we gonna place an implant, of course, we always have to plan the case before. Prior the X-ray, we do a clinical evaluation. We analyze the patient gum health. That's the periodontal health. So we analyze if the gums are okay, if they are inflamed, if they have like tartar buildup or plaque or whatever. Of course, part of what we do before doing the implants is to get rid of any factor that will affect the implant in the future. So we remove the inflammatory aspects of the gum. Then we do the CT scan. On a CT scan, we see the bone height and the bone width. But not just that, we also see the bone density, because we know that there are some densities like ideal for implantation. So if the bone is too dense, we know that the vessels and the biology inside is very bad. And when the bone is too soft, they won't have any stability for them. So we always try to go in the middle. So we analyze this, and based on that, sometimes we do supplementation on the patient, or we do an extra procedures in order to increase the density or to decrease the density, depends of what we need. Another thing is that we have to analyze the anatomical key points that we have in the jaws. For example, in the upper jaw, the floor of the sinus dictates us the height of our implants on the posterior area. On the lower jaw, we have a nerve, the inferior alveolar nerve, that is our lower limit for implantation. Of course, nobody wants to touch a nerve. Another component that we always add to this graft is the PRF. That's platelet-rich fibrin. So pretty much we obtain the blood from a patient, we take a little tubes of blood, we centrifugate the blood in a machine. In that centrifugation separates the platelets with the fibrin to the plasma. That's the configuration of a graft, but also enhance the cellularity because the platelets contains a lot of granules that has a lot of growing factors and stem cells. So at the end, it helps to increase the healing process at least 10 times. So it's something that protects the graft and increase the healing process during it. And everything is completely natural because it comes from the patient's blood. With the hyperbaric, we increase the oxygen concentration in a small area in the body. So it's a chamber that increases the pressure and it pushes the oxygen inside the body. So in general, it increased the amount of vessels, and of course, it removes the oxidative stress. That is something that we don't want in a healing process. The gum around the implant is a great question because the gum is one of the most important variables that we have to take care when we place an implant. The gum have to have a very nice thick layer of keratinized tissue. That's the gum around the teeth. That should be around the implant as well. If the gum is too thin or it has no keratinized tissue, we need to do something to help that gum to be better. So pretty much in those cases, we do a soft tissue graft. We do an incision, we obtain a little piece of gum from the palate, and then we transplant that little piece to the pocket that we create around the implant. We put some stitches and pretty much that's it. It's one of the most important parts of a healthy implant. We need to have a keratinized tissue, healthy, protecting the implant. The sinus is a cavity. In the back side of the cheeks, we have this cavity. The sinus cavity helps to moisture the air every time we breathe, clean the air as well, and also to increase the resonance of your voice. The floor of the sinus is the roof of our teeth. When we lost some teeth, that floor starts to getting down and down because of a breathing pressure. When we plan for implants, we need as a minimum, let's say 10, 11 millimeters in bone height there. So if we don't have 10 millimeters of bone, we need to do a procedure called sinus lift, in which we pretty much do a small incision in the bone, and then we lift that membrane. So we create a bag and we fill that bag with graft. Allowed us to put the implant in a safe environment without perforating the sinus. The socket preservation. When we do an extraction, there are so many things that happens in the socket. The main thing is that everything shrinks because pretty much for the body, same thing, the void spaces are bad. So they start to shrink in order to reduce those spaces. So the healing energy is gonna be less. So when we do an extraction and we don't do a socket preservation, that is, put a graft, of course we always have to clean the socket, remove everything, all the periodontal ligament, we use the ozone, we use everything, and then we need to put a graft. If we don't do a graft, everything is gonna get collapsed. So it's when, for example, you see patients smiling with these black triangles in the middle of the teeth because they lost the height of the gums. So it's very important to try to conserve the socket height and width by socket preservation. So pretty much as a summary, when we do an extraction, we have two options. One option is to put an immediate implant, that is the ideal, or if we have no option to put an implant, then we do a socket preservation. That means that we do a graft and we place something to protect that graft in position during the healing process. We're talking about 4 to 6 months. There are some situations in where we need to create a vertical augmentation. The vertical augmentation is the most complex bone graft that we can do in the mouth because there are so many factors, and the main factor is that as we move from the vessel of the basal bone, less amount of oxygen, and higher risk of collapsing because of the food, eating, tongue, everything. So in this case, we use some plates of bone in order to create like a box. Those plates are obtained from the lower jaw in a very back area. And pretty much the idea of those plates are to create a capsule to let the bone heals in the inside. So pretty much we fix those plates with screws. 6 months after, I remove the screws, clean the area, and then we place the implants. When we try to explain a patient that requires a bone graft, they're always scared because they think that it's another big procedure and it's going to be another healing and another process. But at the end, the bone graft is an add-in. It's something that we always do when we do implants. Because at the end, what we want is to prevent a socket collapsing or shrinking on the bone or shrinking on the gums. And at the end, what we want is to have the implant in the perfect place, in the perfect conditions to receive the crown. So the graft is something that we do during the implantation, and most of the time it takes no more than 10-20 minutes. So in general, it's just something to fill the spaces and to give the patient a more predictable outcome. So we guide the healing process by placing a graft or soft tissue graft as well. The patient is going to have some benefits like better result, more predictable results, less pain, of course, less trauma, and of course, the healing is going to be nicer at the end. So if you want to learn more about bone graft and biological concepts, please follow us in our channel. Thank you for watching and subscribe.